At Visiting Nurse Service, we use telehealth as really an adjunct to the home care plan. The goal here is to keep you safe, stable, and in your home, avoiding the use of the emergency room and hospital as much as possible. The telehealth system is installed in the patient's home by a field service representative who comes in, and very simply there's a modem that gets plugged into a 3-prong outlet in the home, and the devices are whatever the patient needs, if that's a scale, a blood pressure monitor, an oximeter, and the results of those measures will come wirelessly to the web so that the nurse monitoring the patient can see those results within seconds of them being taken.
Most patients love it. Everyone's concerned in the beginning, are they going to be able to use the system? Is this some large computer that's being brought into their house that they're not going to understand how to use? But what they find is that it's very user-friendly, it's very intuitive. It doesn't require a lot of understanding or comprehension. Essentially, you step on the scale just like you would in your own bathroom scale. And what happens after that is all done behind the scenes and with really no intervention from the patient.
Say a patient steps on the scale and their weight is above the parameters the doctor would like. 5 pounds weight gain over a short period of time could mean that you're retaining fluid and your heart failure is worsening. So when we get that result from your weight, and that happens right away, it comes over to the nurse. We'll be able to contact you, find out what other symptoms you're having, any other issues, and then follow up with your provider, and we'll look to make changes to your treatment plan.
We refer patients to the telehealth program very frequently. Especially after hospital discharge, we encourage most of our patients, especially those with heart failure, recent heart attack, or blood pressure problems, to enroll in the telehealth program because it does provide us kind of that virtual hospitalization role to where we can continue to follow the patient, monitor their vital signs, and adjust their medications even after they've left the hospital. With the telehealth program, I'll know what happens tomorrow, and so I can be much more engaged with the patient, much more responsive to changes, and then adjust medications or care plans appropriately. With the use of the telehealth program and the assistance of Visiting Nurse Service, we've actually been able to reduce that readmission rate from that national average of about 25% down to less than 10% since enrolling in the program and using that for our patients. Overall, I think it's just better management of chronic disease processes using this extra information that otherwise we've had no way to be able to obtain.